Hi, thanks for joining. My name is Melissa. I'm a population health specialist, and today we're going to talk about thyroid disorders. This presentation is designed for educational purposes. For medical advice, you should always contact a qualified healthcare professional. So first, we're going to discuss just the basic anatomy. The thyroid gland, you can see here in the image on the screen, it's the pink area. The thyroid gland is a small butterfly-shaped gland that's right at the base of your neck, just below the Adam's apple. It's a piece of other glands that make up what is called our endocrine system. The endocrine system is responsible for many of our body's activities. So you can see also in the picture here, we have the thyroid cartilage. And then underneath the thyroid gland there, you can see the trachea. And then we have our clavicle and our sternum. So some common thyroid disorders that we see and that we hear of are thyroid goiters, hyperthyroidism, hypothyroidism, thyroid cancer, thyroid nodules, and thyroiditis. During this presentation, we will discuss all of these that we have on the screen. We'll go over what they are, some of the signs and symptoms, as well as some more information on them. First, we're going to start with the thyroid goiter. The term goiter is actually an abnormal enlargement of your thyroid gland. Although many times goiters are painless, a large goiter can actually cause some to have a cough. And depending on the size, if it's large enough, it could even cause some difficulty with your swallowing or even breathing. The most common cause of thyroid goiters worldwide is actually a lack of iodine in one's diet. So specifically here in the United States, where we use iodized salt, a goiter is more often due to the over or under production of thyroid hormones or to nodules in the gland itself. Now, the treatment for thyroid goiters really just depends on the size. If it's very small, there may not be a treatment necessary. They may just monitor. Sometimes this can be done with ultrasounds. The doctor can also physically do an evaluation on the neck, and they can feel the thyroid gland. As the gland, the goiter continues to grow in size, that's when the doctor may discuss what treatment options would be best for you. Now, as far as symptoms, not all goiters can cause signs or symptoms. Like we said, they range in size. So if you have a small goiter, number one, you may not even realize it. Number two, you may not have any symptoms or signs of it at all. So when the signs and symptoms do occur, they may include the following. So you might notice a swelling at the base of your neck that might be particularly obvious when you shave or when you're putting on makeup or lotion onto your neck. You may have a tight sensation or feeling in your throat. Some unusual coughing or hoarseness could also be a symptom. Or if you have difficulty swallowing or breathing, and this is something that is new to you, this is something you haven't had in the past, it could possibly be a sign or symptom of a thyroid goiter. Now, you can see in this image, the picture on the left, that's a normal thyroid gland. That's what your thyroid should appear to be. And you can see how it does resemble a butterfly. The image on the right is a goiter. So it's very much enlarged. You can see the shape of the sides and even the base at the bottom. It's very much enlarged. So you can see this one here could potentially cause some of the symptoms that we discussed. You might have some difficulty breathing or even swallowing because it is so enlarged. Now, having a goiter doesn't necessarily mean that your thyroid gland isn't working normally. There are several things that can actually cause your thyroid to become enlarged and to develop into a goiter. Most commonly are the iron or iodine deficiencies that we discussed, Graves' disease, Hashimoto's disease, could be a multinodular goiter, so many different nodules forming to cause it to be enlarged, solitary thyroid nodules, thyroid cancer, pregnancy, or even inflammation in other parts of your body. So some of these things listed are the most common causes for goiter. So it could be many reasons why this is happening. Now, we do know with goiters, it can happen to anyone. They can be present at birth, or they can slowly, gradually become enlarged throughout your life. So we know there are some common risk factors for developing goiters, for developing that enlargement. We discussed a lack of dietary iodine. So some people living in areas where iodine is in a short supply. Here in the United States, we discussed our salt does have iodine in it. So may not necessarily be from that cause here, but people that don't have access to iodine supplements are at a high risk for developing a goiter. Also, another risk factor is actually being a female. Women are more prone to thyroid disorders in general, so they're also more likely to develop thyroid goiters. Now, age does also become a risk factor for a goiter because they are more common after the age of 40. So that's why generally the doctor will recommend doing those routine screenings, and the thyroid is usually included in that at least once a year just to monitor. They're going to feel your neck, have you swallow while they're feeling on your throat area, so they can see if there is any enlargement noted there. Your medical history is also a risk factor. If you or your family has a history of any autoimmune disease, you're at an increased risk for developing a goiter. Having a pregnancy, going through pregnancy or menopause, these are also possible risk factors. Now, the reasons aren't entirely clear why, but thyroid problems are more likely to occur during pregnancy and during menopause. There are certain medications as well that can put you at a higher risk. So some medications like heart drugs, specifically we have noted here amiodarone or Pacerone is the brand name, and the psychiatric medication lithium can put you at a higher risk. So if you're on these medications, your doctor is going to be monitoring a bit more closely to make sure that they're not noticing any enlargement with your thyroid. Another risk factor is having radiation exposure. So your risk for developing a goiter increases if you've had radiation treatments to your neck or chest area, or if you've been exposed to radiation in a nuclear facility, test, or an accident. Now, small goiters that don't cause physical or cosmetic problems usually aren't a concern. And like we discussed earlier, the doctor is probably just going to monitor you. They'll ask you at your visits, are you having any difficulty breathing or swallowing? They'll do, they'll feel on your neck, have you swallow, so they can check the size. They may even want to order an ultrasound just so they can get the exact measurements if they do think that there is some enlargement going on. But large goiters can make it difficult to breathe or swallow and can cause the cough or even hoarseness that we discussed earlier. Now, goiters that result from other conditions like hypo or hyperthyroidism may be associated with a number of other symptoms from fatigue, weight gain, even weight loss, some trouble sleeping, or even some unusual irritability. So if it's affiliated with some other conditions, you may have other symptoms like we discussed here, or even more than this. But if it's just a goiter and all of your other levels are fine, no other conditions, you may not have any symptoms at all or any other complications. So they're just going to monitor. Next, we're going to move to hyperthyroid. So if you have a diagnosis of hyperthyroidism, what that means is you have an overactive thyroid. So it happens when your thyroid gland makes more hormones than your body actually needs. There are several causes that could cause hyperthyroidism. Graves' disease, which is an autoimmune disorder when your immune system actually attacks your thyroid gland and causes it to make too much of the hormone. So Graves' disease is the most common cause of hyperthyroid that we see, but there are some others. So thyroid nodules, which we'll discuss in a few minutes, those are growths on your thyroid gland. They are usually benign, which is non-cancerous, but they may become overactive and make too much of your thyroid hormone. Thyroid nodules are actually more common in older adults. So again, this is something that your doctor is going to be doing those routine screenings and monitor your health, check your levels, and make sure that there's nothing changing. But another cause for hyperthyroidism could be thyroiditis. This is an inflammation of your thyroid gland. So this can cause stored thyroid hormone levels, some of your hormone in the body, to actually leak out of the thyroid gland. And then the inflammation would occur, which then your levels could be thrown off. Also, too much iodine. So we discussed the iodine in salt here that we have in the United States, but iodine is also found in some medications like cough syrups, even some seaweed and seaweed-based supplements. So taking too much of these can cause your thyroid to make too much of the thyroid hormone. Another cause of hyperthyroidism is too much thyroid medication. Most commonly, we see Synthroid, levothyroxine, some other medications. So if your levels are changing, but you're still taking the same dose, this could be a cause for you to convert into hyperthyroidism. So this can happen if you're taking the thyroid hormone medication for hypo, which is underactive, but you're just taking more of it. So then you're going to flip-flop into hyper. So instead of having an underactive, now you're going to have an excessive amount of the hormone and you will convert into overactive thyroid. So again, this is another reason why the doctors do monitor your hormone levels when you do have a diagnosis of any thyroid condition. And they want to make sure that you're taking your medication the same time, the correct dose every day. There are certain people that are at a higher risk for developing hyperthyroidism. So again, women are at a higher risk for thyroid conditions. If you are older than 60, you're at a higher risk for developing this diagnosis. If you have been pregnant or had a baby within the past 6 months, your hormone levels are adjusting, so you are at a higher risk for developing hyperthyroidism. Also, if you've had any thyroid surgery or a thyroid problem like a goiter, if you've had surgery to remove nodules, things like that, you are at a higher risk for developing this as well. Any family history of any thyroid disease, hyperthyroid, hypothyroid, Hashimoto's, things like that, in your family history can put you at a higher risk. Also, having anemia, pernicious anemia, can put you at a higher risk for this. So pernicious anemia is when the body can't make enough of your healthy red blood cells because it doesn't have enough vitamin B12. It has to have certain vitamins and other hormones and within the body to make our fresh and healthy cells for our body to function appropriately. So if you're low on B12, then you're at a higher risk for developing hyperthyroidism. Another cause could be having type 1 diabetes or having a diagnosis of primary adrenal insufficiency, which is another hormonal disorder. So you can see here, having different hormone conditions can put you at a higher risk for developing hyperthyroidism. So if you're noticing any changes, anything new, it's very important to talk to your doctor so they can do the appropriate testing to see what's going on. The last risk factor that we see on here is getting too much iodine. So eating large amounts of foods containing iodine or using those iodine-containing medications or supplements can put you at a higher risk for developing this condition. Now, there are some symptoms that we see more commonly with hyperthyroidism, but this can vary person to person. Some people may not have any or just very few of the symptoms, and some may experience multiple. So the most common that we see, unusual nervousness or irritability. Maybe this is something that's changed. You're not doing anything new with your daily activities, but you're just noticing that you feel more nervous, more fidgety, or irritable than normal. Also unusual fatigue. So if you're just extremely tired, very exhausted, and this is something new for you, maybe you're used to just going and doing your exercises, doing your activities and your sports possibly that you're doing, and now you just feel severely fatigued and aren't able to do the normal functions and activities that you would previously. We can also see some unusual muscle weakness as a symptom of hyperthyroidism, as well as some trouble tolerating heat. Now, if you're used to working outdoors or exercising outdoors and all of a sudden now you're not able to even walk outside to check the mail because you just cannot tolerate the heat or humidity, this could potentially be a symptom of hyperthyroidism. Some others we see on here, some unusual trouble sleeping, some unusual tremors, and these are usually in your hands. Rapid and irregular heartbeat, so really fast pulse. Even some frequent bowel movements, looser stools, or even diarrhea, if that's something new for you. And it's not a stomach bug, it's not something you ate. If it's something that's been happening more frequently, could potentially be a symptom. Unusual weight loss is also a potential symptom. Mood swings could possibly be as well. Now, the last one on here is goiter. So we talked about that earlier in the previous slide. So the goiter is that enlarged thyroid gland that could cause your neck to look swollen. So pending the size, you may even be able to see it in the mirror when you're looking at your neck. And we talked about it could cause some trouble with your breathing or swallowing if the size is become extremely enlarged. Now we know as far as the overall symptoms for hyperthyroidism, adults over the age of 60 may have different symptoms than those in the younger ages. So they may lose their appetite or withdraw from other people. And on occasion, these symptoms can even be mistaken for depression or dementia. So if you're noticing any of these symptoms, like I said, it's very important to talk to your healthcare provider so they can do some tests to see if what's going on, if it is your thyroid that's causing these things to happen to you. Now, when you are noticing some of these symptoms occur and it's out of the ordinary from your normal day to day, maybe you also notice that your neck is looking a bit more enlarged. So write down these things. Write down, okay, on this day I felt unusually fatigued. I couldn't go out and do my walking that I normally do. I'm also noticing some weight loss. It started on this day and now I've lost 11 pounds and I'm not changing my diet or exercising differently. So to make a diagnosis of hyperthyroidism, your doctor is going to need to know your medical history. So all of the symptoms that you've been noticing, the symptoms you're experiencing. They're also going to do a physical exam. So they will, again, they can feel your neck so they can check your thyroid gland, see if there is any enlargement. They may also want to do some lab tests. So the lab tests to check for the thyroid are generally a TSH, which is thyroid stimulating hormone, T3 and T4, as well as they may want to order some thyroid antibody blood tests. These are all non-fasting, so they can really do it at any time of the day. But if this is a possibility, they may order the ultrasound so they can get the actual measurements of your thyroid gland. They may do a thyroid scan or even do a radioactive iodine uptake test to see exactly how your thyroid gland is performing. So the iodine uptake test will measure to see how much radioactive iodine your thyroid is taking up from your blood. So this is usually a pill that you'll swallow, and then they'll put you under the scan machine and they'll be able to monitor what your thyroid is actually pulling in. So these could possibly be some tests that the doctor or healthcare provider would order to be able to make a correct diagnosis as to if it is hyperthyroidism or another thyroid condition. Now, some treatments, if you do get a diagnosis of hyperthyroidism, they could be medication treatments, it could be some radioiodine therapy, or depending on exactly what is going on, it even could be surgery to treat this condition. So some of the common medications that are given for hyperthyroidism would be anti-thyroid medication, which these medications actually cause your thyroid to make less of the hormone. So hyperthyroidism is excessive, it's more, so we want it to make less. So they're going to give you a medicine to kind of to decompress the thyroid from stimulating all the hormone. You will probably need to take the medications for at least a couple years, but depending on your numbers when they're checking your levels, depending on where your numbers are, if they're trending more towards the normal range, it may or may not be a lifelong medication that you have to stay on. The medications are usually the easiest treatment, but it's often not a permanent cure. So you may take the medications for a couple years, your thyroid then becomes within the normal range, but there is a possibility in the future that you may revert back to hyperthyroidism. Another medication that can be given for hyperthyroidism are beta blocker medicines. These can actually reduce some of the symptoms that you're experiencing, like your tremors, the hand tremors, fast heartbeat, and nervousness. Now, these actually work fairly quickly and can help you feel better until the other treatments take effect. So they may give you an anti-thyroid medication as well as a beta blocker if your symptoms are more severe. The beta blockers, they're going to slow your heart rate. They're going to calm you down a bit, and those are going to work more quickly than the anti-thyroids would. Another treatment possibility for hyperthyroid is radioiodine therapy. So this is pretty common and generally very effective in treating hyperthyroidism. So it involves taking radioactive iodine by mouth as either a capsule or even a liquid. This, like we said, it's going to help with the overproduction of the hormone. But in number 3 here, we'll see pending the severity of your thyroid condition, surgery may also be a treatment that's necessary to remove part or even most of the thyroid gland. Now, this is rare as far as treatment, but if the symptoms and hormone levels are more severe, this may be the option that your doctor discusses. Now we're going to move to the opposite end of the spectrum, and we're going to talk about hypothyroid. So this is an underactive thyroid. So your thyroid isn't making enough of the hormones that your body actually needs. Now for this, there's also many causes that we see. So Hashimoto's disease is an autoimmune disorder where your immune system actually attacks your thyroid gland. So it's attacking your thyroid, and then your thyroid is not able to produce the hormones that it needs to in order for your body to function correctly. Hashimoto's is the most common cause of hypothyroidism, but it could be from these others that we have listed here. So thyroiditis, again, is the inflammation of the thyroid gland. Congenital hypothyroidism, which is where you have this condition that's present at birth. Hypothyroid could also be caused from having surgery to remove a portion or all of the thyroid gland. Radio treatments of the thyroid could cause some underactive thyroid as well as certain medications, and in rare cases, a pituitary disease or in too much or too little iodine in your diet. So like we said, the most common cause is Hashimoto's, that autoimmune disorder, but it could even be from some of the other things listed on here. Now, there are some that are at a higher risk for hypothyroidism. So again, women are at a higher risk, as well as those over the age of 60. If you have ever had a thyroid problem in the past, like a goiter, you're at a higher risk. Also, if you've had any surgery to correct a thyroid condition, if you've received any radiation treatments in the thyroid or neck area, or if you've had a family history of any thyroid disease, or were pregnant or had a baby in the past 6 months, you are automatically at a higher risk for getting a diagnosis of hypothyroidism. Some others that are listed here on the right side, these are a bit more specific. So having Turner syndrome, now this is a genetic disorder that generally affects females. Also, if you've had that pernicious anemia that we talked about, so the low vitamin B12 level. Having Sjogren's syndrome, which is a disease that causes dry eyes and dry mouth. This can put you at a higher risk for hypothyroidism, as well as having type 1 diabetes, rheumatoid arthritis, or even lupus. If you have any of these conditions listed here, you are at a higher risk for having hypothyroidism, your underactive thyroid. Some of the symptoms that we generally see with hypothyroid are fatigue, weight gain. Now remember, with hyperthyroid, we had weight loss. So now when it's underactive, you may have some weight gain because your thyroid gland is not producing enough of the hormones that your body actually needs. You may also notice that your face is a bit swollen. Your face might look a little puffy. Now with hypothyroid, you might have some trouble tolerating cold weather, cold temperatures. You might have some unusual joint and muscle pains, even some constipation, dry skin, dry or thinning hair, a decreased amount of sweating. So this is one that if you're usually a heavy sweater, when you go out and do some exercise or work in the yard, with hypothyroid, you may notice that you're not producing as much sweat as you were before. Maybe just a very small amount, even in the extreme heat. For women, having heavy or irregular menstrual periods could be a symptom of hypothyroidism. Also, there could be some fertility problems in women with this condition. May also notice some depression, even a slower heart rate. So you can see how they're opposite. With the hyper, we had the fast heart rate, we had the diarrhea, we had weight loss. Now with hypo, we're having the complete opposite. Goiter is also a symptom of hypothyroidism. The enlarged thyroid, that can put your hormones just completely out of whack. It may be producing more hormones, or it could be causing it to produce less. So because hypothyroidism usually develops slowly, many people don't notice any of the symptoms for many months or even years until the symptoms become more severe. Like we said, with the fatigue, some people do experience fatigue. They may experience dry skin, constipation, slowed heart rate. This might be something that you're already experiencing, so you may not think it's anything out of the ordinary. But months to years down the road, when the symptoms become more severe and you develop some of the other symptoms listed here, then you might start to notice and talk to your doctor about it, so they can do the appropriate testing to see what's going on. So as far as getting the diagnosis of hyperthyroidism or hypothyroid, they're very much the same. Excuse me. They're very much the same as far as how your doctor or healthcare provider will make that diagnosis. So they're going to ask you about your symptoms, They're going to do a physical exam. They'll palpate, they'll feel around your neck to check your thyroid gland. They may want to do some blood tests to check your levels, as well as some imaging tests. Again, the exact same that we discussed with hyperthyroidism. The same tests and things are done to be able to diagnose hypothyroidism. Now, the treatment for hypothyroid is medication to replace the hormone that your thyroid gland is no longer making. So after about 6 to 8 weeks, after you start taking the medications, your doctor will probably order a blood test to check and see where your levels are. They may need to adjust your dose of the medication that you're taking. In general, it does take a couple times to make sure your levels are right within the range that it needs to be. So each time your dose is adjusted, you'll need to have another blood test to make sure that you are right in the level where you need to be. And then once they do find the right dose where your levels are stable, then they might want to move the blood test to 6 months. And then if you're stable at that time, they may want to test you once a year. Now, in between those blood tests, if you're noticing that some of the symptoms are starting to reoccur or getting worse, you definitely should talk to your doctor so they can order a lab test sooner than planned, just to make sure your levels are not going off again. The next condition that we're going to discuss is thyroid cancer. Now, thyroid cancer occurs in the cells of the actual thyroid gland, and you may not have any symptoms at all at first, but as the cancer grows, it can cause pain and swelling in your neck. Now, you can see in the picture over here on the right, the thyroid gland, that butterfly-shaped gland there, it has a small tumor in the left bottom area. So that's where the cells are. It's developing in the cells, and it will continue to grow, and it can cause the pain and swelling eventually over time. So there are actually several types of thyroid cancer. Some of them grow very slowly, and others can be very aggressive. Most cases of thyroid cancer in general, they can be cured with certain treatments. Thyroid cancer rates actually seem to be increasing, and some doctors tend to think it's because new technology is allowing them to find smaller cancers that may not have been found in the past. So they may be able to find these cancers before they're causing any symptoms, before they're causing any pain, or even making any swelling in your neck. So that's good, because they're able to find the cancer, diagnose it, and then do the treatment before it does cause any problems. Some symptoms that we do know as far as thyroid cancer. Again, usually at first, early on with the diagnosis, you may not have any signs and symptoms. But as the cancer continues to grow, it might cause a lump that can be felt when you touch your neck area where your thyroid gland is. May also cause some changes to your voice, like increasing hoarseness. May also cause some difficulty swallowing, because as the as the cancer continues to grow, it could cause some pressure in your neck area, as well as even some pain in your neck and throat. May also notice that your lymph nodes in your neck become swollen. So again, this is something that early on, if you don't have any signs and symptoms, when your doctor's doing their physical check on you, when they're checking and feeling your neck, they may notice some changes, may notice some swelling with your thyroid gland or lymph nodes, and then they want to do some further testing to see exactly what's going on. Now, as far as a cause of thyroid cancer, it's not actually clear what causes this. We know thyroid cancer happens when the cells in your thyroid gland have some genetic changes. So the mutations, the changes, allow the cells to grow and rapidly multiply. The cells also lose the ability to die, just like normal cells would. See, then the accumulating abnormal cells form into a tumor, form into that tumor that we saw in the previous picture. And then the abnormal cells, the abnormal tumor, can then invade the nearby good tissue, and it can even metastasize or spread to other parts of the body if left untreated. So we're not really sure exactly what causes thyroid cancers, but we know once it's there, how it spreads. Thyroid cancer is actually classified into different types based on the kinds of cells that are found in that cancerous tumor. The specific type of cancer is determined when a sample of tissue from the cancer is examined. So they would do a biopsy and then examine it under a microscope to see exactly what those cells are. And then the type of thyroid cancer is definitely considered when they're determining what treatment would be best. So we'll go over a few of them here. So on the left, papillary thyroid cancer is the most common form. It usually happens from follicular cells, which those are the cells that produce and store our hormones, our thyroid hormones. Papillary thyroid cancer can occur at any age, but most commonly affects people between 30 and 50. Doctors sometimes refer to the papillary thyroid cancer and follicular thyroid cancer together as differentiated thyroid cancers. So right below that, the follicular thyroid cancer, it also arises from the follicular cells of the thyroid. It usually affects people over the age of 50. And then Hürthle cell cancer is a rare and more aggressive type of follicular thyroid cancer. But again, remember these different cancers that we're talking about here, they would need to do a biopsy of the tumor to determine exactly what type it is. Moving to the right side of the column there, medullary thyroid cancer, it begins in the thyroid cells called C cells. Those are the ones that produce the hormone calcitonin. So higher levels of calcitonin in the blood can indicate medullary thyroid cancer at a very early stage. There are certain genetic conditions and syndromes that put you at a higher risk for this, but there has not been a the genetic link is uncommon. So there are certain syndromes and conditions that increase the risk, but there's really not the link there yet. Anaplastic thyroid cancer is a rare type of thyroid cancer that begins in the follicular cells. It actually grows very quickly and it's very difficult to treat. It usually occurs in adults, people over the age of 60. And then other rare types of cancer that start in the thyroid are thyroid lymphoma, which actually begins in the immune system cells of the thyroid. And thyroid sarcoma is another type, and it begins in the connective tissue cells of the thyroid. So you can see there are many different types of thyroid cancers. And in order to make that actual diagnosis, there is a lot of evaluating and a lot of testing that would need to be done to determine exactly what it is and what treatment would be best to treat it, as well as the prognosis for the cancer. To get these diagnoses, your doctor may refer you to a specialist called an endocrinologist. They would be the ones to order the special testing. If your physician does not, they may refer you to a specialist for this. There is a few lists, there are a few risk factors for thyroid cancer. Again, females, it's more common in women than in men, and that's with all of the thyroid conditions that we've discussed. High levels of radiation, so some exposure to the head and neck puts you at a higher risk for getting thyroid cancer. And then there are certain inherited genetic syndromes that put you at a higher risk as well, like familial medullary thyroid cancer, multiple endocrine neoplasia, Cowden syndrome, and familial adenomatous polyposis. So these are some genetic conditions, some inherited syndromes that could put you at a higher risk for getting a diagnosis of thyroid cancer. So again, we see here it's very important to make sure you're having those routine screenings, make sure your physician is aware of your family history as well as any unusual symptoms that you may or may not have. Next on the list, we will talk about our thyroid nodules. Now you can see in the image here, the bottom image on the left, that's a thyroid with a single nodule, just one nodule. The rest of the gland is normal size, normal shape. But the picture on the bottom right there, this is what's called a multinodular goiter. So this is a thyroid gland with multiple nodules in it. You can see the nodules are causing the size and shape to be more enlarged. Now, thyroid nodules are solid or fluid-filled lumps that form within your thyroid. Most thyroid nodules are not serious and don't cause symptoms. Only a small percentage of them are cancerous. So this is also something that your doctor is going to want to make sure they're monitoring the shape, the size, any symptoms, any unusual pieces to it. Some symptoms for thyroid nodules, generally they don't cause any signs or symptoms, but if they do become enlarged, they may be able to be felt. If you just, your doctor just feels on your thyroid gland, they may be able to feel the goiter or the nodules there. They may be able to be seen. So there's often seen as a swelling at the base of your neck where your thyroid gland is located. You could press on your windpipe the nodules could press on your windpipe or esophagus as they continue to grow, which then again would cause some shortness of breath or even difficulty swallowing. In some cases, thyroid nodules produce additional thyroxine, which is a hormone secreted by your gland. The extra hormone can cause symptoms of an overproduction. So remember, overproduction is hyperthyroidism. So you may have some of those symptoms, like the unexplained weight loss, increased sweating, tremors, nervousness, or even faster irregular heartbeat. So depending on if your thyroid nodules are smaller, maybe they're not causing any additional hormones, then you may not have any symptoms. But as they continue to grow, and then if they're producing more of the hormones, you may start to notice some other symptoms to go along with them. There are only a small number of thyroid nodules that are cancerous, but determining which of those nodules are cancerous cannot be done by evaluating and you noting your symptoms. Most cancerous nodules are slow growing and may be small when your doctor finds them, but aggressive thyroid cancers are rare, with nodules that might be large, firm, fixed in one location, and usually rapid growing. So when to see a doctor? When do you see a doctor? With your thyroid nodules, like we said, they're usually non-cancerous and don't cause any problems, but you should talk to your doctor about evaluating any unusual swelling in your neck. If you've felt some difficulty when you're swallowing or having some unusual trouble breathing, or if you've seen when you're looking in the mirror, if you notice some unusual swelling, it's very important to talk to your doctor because they want to make sure that they evaluate for the possibility of cancer. Again, if you develop any of the signs and symptoms of hyperthyroidism, the overactive, like your sudden weight loss, even though your appetite and exercise has not changed, a pounding heart, if you have trouble sleeping, unusual muscle weakness, nervousness, or irritability, those are the symptoms of hyperthyroidism. On the other hand, when you have hypothyroidism symptoms, so feeling cold, feeling tired more easily, dry skin, having some unusual memory problems, depression, or even constipation. If you have any of these signs and symptoms listed or any of the other ones that we discussed, it is incredibly important to talk to your healthcare provider to let them know what's new, what's changing, so they can decide what the appropriate test would be to see what's going on. They may order multiple tests if there's a potential for multiple conditions, multiple diagnoses. But it's always important. Just tell them anything new, tell them any changes so they can do, that's their job. Their job is to take care of you, to keep you healthy. So if anything changes, they need to know. Now, with thyroid nodules, there are some causes that we do know of. So an overgrowth of your normal thyroid tissue. It's sometimes referred to as thyroid adenoma. I'm not really sure why this occurs, but it's not cancerous, and it isn't usually considered serious unless it's causing some symptoms from its overgrowth. As it continues to grow, it may or may not cause symptoms, but it's a potential for cause of thyroid nodules. Another cause could be a thyroid cyst, which is a fluid-filled space in the thyroid, most commonly from degenerating thyroid adenomas. So if there is an overgrowth, then you potentially could develop a cyst. Some people do, some people don't, but the cysts are usually non-cancerous as well, but they occasionally can contain cancerous components. So again, very important to make sure you're talking to your doctor about any new symptoms or any changes. Another cause of thyroid nodules are chronic inflammation of the thyroid gland. So that Hashimoto's disease that we discussed can cause thyroid inflammation and result in enlarged nodules. In general, this is usually associated with hypothyroidism. So you may have Hashimoto's disease, you may have some multinodular goiter, so multiple nodules causing this enlargement, as well as a diagnosis of hypothyroidism. Thyroid cancer is also a cause that we could see of a thyroid nodule. So the chances that a nodule is cancerous is actually very small, but a nodule that is large and hard, if it's causing some pain or discomfort, it could be, it's more worrisome. So then you definitely want to have it checked out by your doctor to see what's going on. Then the iodine deficiency, so lack of iodine in your diet, can sometimes cause your thyroid gland to develop some nodules. Again, iodine deficiency is uncommon in the United States, where we have iodine routinely added to our salts and other foods. And then here at the bottom, a multinodular goiter. This is what we saw in the picture on the previous slide. This is the term used to describe an enlargement of the thyroid gland. Multinodular goiter generally contains multiple distinct nodules within the goiter. So in the picture that we saw there, it's a lot of different nodules that have caused the thyroid gland to be very much enlarged, and it can continue to grow and eventually can cause some of the symptoms like the trouble swallowing or hoarseness. Now, the cause is less clear as to why this occurs, but we know it can be a cause. So again, please note any changes or anything new that you're experiencing to your doctor so they can see what's going on. All right, lastly here on the list is thyroiditis. This is the term refers to inflammation of the thyroid gland. So itis at the end of a word, itis means inflammation. So inflammation of the thyroid. Thyroiditis includes a group of individual disorders that cause some inflammation, but they generally present in different ways. So again, here we have Hashimoto's thyroiditis. This is the most common cause of hypothyroidism in the United States. So there's an inflammation within the thyroid gland causing it to be underactive. So the inflammation you have, and then you have, it's not producing enough of the hormones. The second one here is postpartum thyroiditis, which causes temporary high levels of the hormone in your blood, followed by temporary hypo. So you have high levels and then you have low levels. It's a common cause of thyroid problems after delivery of a baby. So we know with pregnancy, there are a lot of hormonal changes that happen in a woman's body. And with the thyroid gland, that can be one of the ones affected. So some people do experience this and they may go from hypo to hyper. So it's something that is routinely monitored with lab tests and observation of any symptoms. The third one here is subacute thyroiditis. It is the major cause of pain in the thyroid. Thyroiditis in general can be seen in patients that are taking the drugs interferon and amiodarone. So if you're on these medications, your doctor is most likely monitoring you more closely to make sure that there are no changes happening with your thyroid gland, as well as with your hormones. Some facts about thyroiditis. It usually results from an attack by the body's own immune system against the thyroid gland, then causing some inflammation and damage to your healthy thyroid cells. There are certain drugs or even infections by viruses or bacteria that could cause thyroiditis. Now, as far as symptoms, there's really no symptoms specifically for this condition. If the thyroiditis causes slow thyroid cell damage, you may have some changes in your hormone levels. The levels may fall, they may drop, and you may experience some of the symptoms of hypothyroidism. But if the thyroiditis causes rapid thyroid cell damage, then you may experience some of the symptoms of hyperthyroidism. So we have a lot of overlapping conditions here, and knowing the symptoms of hypo and hyperthyroidism are important, because if these symptoms occur and they're not common for you, talk to your doctor so they can do the testing and see exactly what's going on, and then hopefully get the treatment so you can get back to your normal levels and your thyroid gland can get regulated. Different types of thyroiditis. We talked about Hashimoto's, so this is autoimmune. Patients with Hashimoto's thyroiditis usually have the symptoms associated with hypothyroidism, and this is usually permanent. Usually the symptoms and this condition is usually ongoing. Number 2 on here is subacute, painless, and postpartum thyroiditis. And this again is associated with pregnancy and delivery, because the hormone levels are trying to get back to regulating. Thyroidal pain in subacute sometimes can occur, so you might have some pain, but with this postpartum and subacute thyroiditis, most patients will have their thyroid function get back to the normal level within a year to a year and a half. Number 3 is drug-induced and radiation thyroiditis. So you may experience thyrotoxicosis, a lot of big words in this seminar, as well as hypothyroidism with this. The thyrotoxicosis is usually short-lived, but drug-induced hypothyroidism often resolves with stopping the medication. And with the radiation, the hypothyroidism related to radiation, it's usually a permanent condition that you experience. Last one on here is acute or infectious thyroiditis. Some of the symptoms may be pain. You may have a systemic illness, just an overall illness within the body. May also have a painless enlargement of the thyroid gland, as well as some of the hypothyroidism symptoms. Now, these symptoms usually go away after the infection has cleared up. So you can see the variation of different types of thyroiditis that some may experience. Some of them are permanent, some of them can be resolved, but it's a big range that one can experience with the inflammation within the thyroid gland. Some treatment, similar to what we discussed in the previous slides. So with thyroid toxicosis, some beta blockers may be helpful to treat some of the symptoms. If you're having some palpitations, fast heart rate, or tremors, the beta blockers may be given to provide some immediate relief. Also, anti-thyroid medicines with thyroid toxicosis, they're not effective to treat thyroid toxicosis because of the inflammation. Some other treatment, hypothyroidism, so they may give you some medication, some hormone therapy, some pills to take, Now, the treatment should be continued. Take it the same time every day. Try not to miss any doses. Take it as you are directed, because if you miss doses, your levels can get thrown off very quickly. Another thyroiditis treatment, the pain associated with some subacute thyroiditis can usually be managed with some anti-inflammatory medications. Now, this is something that your doctor will advise you of. They will let you know what anti-inflammatory medication you should take, because some people are better with some and not others, depending on your other health conditions. Now, on occasion, the pain can be severe and may require steroid therapy with even prednisone. So again, this is not something that if you feel this pain, you just go and take some ibuprofen or some aspirin. Definitely talk to your doctor. Let them know what's going on so they can give you the appropriate treatment that can take care of the symptoms that you're having, or at least get you back within the normal ranges. So some tests, we've discussed them with the hypothyroidism and hyperthyroidism, some tests that the physician may want to order to see exactly what's going on if you do have a thyroid condition. So the lab tests, we can see the values here. These are the normal values. Now, some labs have a bit of a variation, but in general, this is from the American Thyroid Association. These are the normal values that we want to see. So your TSH, that's the thyroid stimulating hormone, your T4, T3, free T4, and then TPO, that's your antibodies test. These are some common blood tests that a physician or healthcare provider may want to order if there is a possibility of a thyroid condition that you're experiencing because of your symptoms that you're discussing with them. So if you want to take a screenshot of this slide here, it can show you the normal ranges, and then as you're reviewing your lab tests, you can see where you fall, if you're below, within the normal, or even above. Now, these are the resources that I've used for this presentation. You are able to click on these. It'll take you to the pages if you want some more information. I hope you've gotten some good information from this presentation. And if you have any other questions, you're welcome to contact the Villages Health Learning Center, or you can talk to your healthcare provider if there is something that you're experiencing that maybe you have some more questions about. I hope you have a wonderful day, and thank you for joining.